registered nurse with more than 30 years of experience in various healthcare settings. She started her career in emergency nursing and has led teams delivering high-quality care for patients across a broad spectrum, ranging from outpatient clinics to ICUs. Additionally, she has led teams to drive significant financial and operational results through systems redesign and system integration efforts. Faye's varied background provides a sound foundation for her current passion of ensuring that leaders have the knowledge, skills, and ability to achieve their goals. Please welcome Faye Sullivan.
Thank you. You know, in 2015, I was at work in one of your organizations, actually, as a coach, and I received a phone call. It was the middle of the day, and even though we're not supposed to do this, I did the kind of peek because I felt the vibrating in my pocket. You've done that. And I saw it was from my mom's house. Now, my mom's 80 years old. She's a nurse. I've been a nurse for 60 years. And she has a work ethic like nobody's business. She doesn't call me in the middle of a work day. But I was busy. I was in a meeting, and I didn't take the call. About 3 minutes later, my pocket vibrates again. And I snuck another peek, and it was from my mom's house. So at this point, my antenna's wiggling, and I excused myself from the meeting that I was in, and I went out and I returned the call. It was not my mom that answered the phone. It was my brother. And he said, "Faye, thank God you called me back. I stopped by to have lunch with Mom today, and she's still in the bed." "What?" "She's still in the bed." He said, "I don't know what's going on. She's barely responsive. I've already called 911. And that began her journey through the other side of healthcare. And I want to spend the next few minutes sharing some highlights from that journey with you in hopes that it makes a difference for you and in your organizations. I'd ask you to take the journey with me along as I describe what my family and my mom went through, but I'd ask you also to take a parallel journey as we talk today. I'd ask you to think about what's going on in your own organizations right now and the journey that your patients are going through and your team is creating for those patients. Think of it, if you will, as a tracer methodology as you're preparing for Joint Commission, and ask yourself, could these things that happened to us and for us, could they be happening in your own organization? So the journey began with the emergency medical team arriving at my mother's home, and if my brother were here today, he would tell you what an incredible team that was. They were compassionate, they were quick, they were clearly knowledgeable, they asked him the right questions, and they helped him feel better when he didn't have the answers to all of their questions. And it didn't take long for them to get her loaded up and in the back of their truck and on the way to the emergency department. He followed along quickly behind. You know, when you get to the emergency room, you know how they do? The family gets shuttled off this way, and the patient gets shuttled off this way, particularly when it's an 80-year-old unresponsive woman. She goes into the trauma room, and it was close to an hour later before he was able to get back there. And we'll never know today whether in that first care transition between the EMTs and the nurses who received my mom, we'll never know if the information about her drug allergies, her antibiotic allergies, was communicated and not retained, or whether it was never communicated at all. But it had a pretty significant impact because, as it turns out, it's difficult to discern the difference between a septic 80-year-old woman, meaning a bloodstream infection that was causing profound system impact, and anaphylaxis, the reaction to an antibiotic. And so the next 24 hours was incredibly tenuous and was significantly complicated by the fact that that one little piece of information in that transition of care didn't go the way we would have done it by the book. That said, the care that was delivered in the emergency department was incredible. My brother shared with me the story of the physicians who came in and did a terrific job explaining to him the assessment that they had done, the fact that they did not believe she had had a stroke, that they had started her on their sepsis protocol. She was intubated. She was on drugs to help sustain her heart and her breathing. And they were right there at her bedside, and they were reassuring him every step of the way. She stayed in the emergency department for several hours, and so there were transitions. There was the day nurse transitioning to the night nurse. There was the day physician transitioning to the night physician. And as far as we knew, all of that went really well. And eventually, she was able to get up to the intensive care unit. In that ICU, at this point, I had managed to get back in town, and I was there. And again, as a family member, at change of shift, we're shuttled off to the waiting room, and the nurses do what they do in the patient's best interest to keep them safe. They have the family outside the room, and they did their transition, their care transition, over the course of that shift report that happened at my mom's bedside. At 8:01 p.m., I found myself walking back into the ICU, into her room, because we were allowed to come back in at the end of the hour, so it didn't take me long after that hour to pick up the phone and get back inside. And here's what happened for me. Now, you heard that I'm a nurse. Been a nurse for almost 40 years now. So my mom, a nurse for 60 years, I'm a nurse for nearly 40 years. We've got some experience in this environment. But I'm anxious, and I'm worried, and I'm looking at her, and she's not looking good, and I don't know where this journey is going to land us. I don't know what's ahead of us. What I do know is the care that she was receiving at that moment and the caring that my family was receiving at that moment. So there was a nurse, his name was Marcus. I remember him like yesterday. He took my mother's pale, frail hand between his big, dark hands, and he squeezed. And I didn't know if Mom knew he squeezed, but I knew he squeezed. And he said, "Miss Virginia," to my mom, "Miss Virginia, my name is Marcus. I'm going to be your nurse all night long. I'm about to tell you everything I've just heard about you, everything I know about you, and then I'm going to ask your daughter to tell me what else I need to know to make sure that this is the very best night you've ever spent in an ICU." Never mind that it was the first night she'd ever spent in an ICU. I want to tell you, I wanted to kiss that man on the lips. And I thought to myself, we got lucky. We got lucky to be in this hospital with this particular person taking care of my mom tonight. And we were, and that's the kind of care she received over the next several days as they teased apart all the things that were going on with her and helped to stabilize her and helped to bring her back to the health that she had had before coming to the emergency room. In about 3 days, maybe 4 days, we were able to then move out to an inpatient unit. So that's progress, right? We're very excited about that. She's going out to the medical unit, and I'm going along with her. And as we get out there, I was thrilled to find out that in this organization, the nurses practice bedside shift report. That's a big deal to me. I'm a coach. I coach bedside shift report. I know how important it can be. Here's what we found. Those care transitions from care team member to care team member, as we moved along that continuum of care, were quite variable. In fact, there were times that within 2 minutes of the nurses leaving the room, my mom, as tired and as ill as she was, would look at me, and I would either get a thumbs up or I'd get a thumbs down. And she would say to me, "We got the A team." Is that a big deal? It was to me, because we got the A team meant I got to go home and take a nap. I got to go home and take a shower. We got the B team means I'm staying here, I'm not leaving your side for the next 12 hours. Because if she didn't trust them to care for her, I didn't trust them to care for her. How did she make the decision that it was the A team or the B team? In that 5 minutes that they were standing at her bedside and having a little conversation, she didn't know where they went to school. She didn't know their clinical skills. She didn't know their experience. She didn't know the quality that they could deliver, but she knew the quality of their interaction, and she knew the attention to detail, and she knew whether they treated her with dignity, with respect, if they engaged her as a part of her own care, and it was profoundly important to her. And when it was important to her, it was important to me. She did continue to improve, and it became clear to us that this journey might have a happier ending than I had thought now a week or 10 days before. And more members of the team became involved in her care as she planned for the inevitable trip to a post-acute rehab unit so that she could regain strength to eventually go home. This was a complex and confusing time because Mom already had some comorbidities, some things that she came into the hospital with. But when she came in, she had only been on 4 medications. When she left there, she was on 12 medications. And the team that was helping us prepare to care for her in the post-acute setting and in the home setting were terrific. They gave us tons of information. They explained everything we needed to know. But what they didn't do was coordinate their care. And so I'd have a nurse telling me one thing and a care manager telling me something else. And then when we got to rehab, it was even more complicated, because we had people who were introducing us to new technologies that we'd never used before. She'd never used a walker, she'd never used a wheelchair, she'd never used oxygen at home. Now, I know how to handle those things. I've been a nurse a long time, but I'd never tried to use those things with my own mom. And even though I had the kind of experience and she had the kind of experience that she had and that I had, we were ill prepared to care for her in our own home. But 10 days after going to the rehab unit, that was our challenge. And off we went home. And we were excited. We wanted her to be there. 48 hours later, I was a wreck. Combined 100 years of healthcare experience taking care of patients between the two of us, and we couldn't figure out all of those medications. I couldn't figure out an oxygen concentrator and how to fill our own oxygen tanks. I couldn't figure out how to get all of the care coordinated between the therapist that was coming into the house and the nurse that was coming into the house and the care tech that was coming into the house. And I had been sleeping in a Barca lounger in her room, her bedroom, for the last 48 hours, and I just couldn't handle it. We were that family that's about to call 911 to say, take us back. Have somebody manage her care. And when I look back on it now and I think, seriously, you couldn't figure that out? What I want you to take away is it doesn't matter the experience, the intelligence, the skill, the previous life that your patients and their family members have had. What we have to understand is that this is complicated. It's complex, and we can do a better job in helping people prepare for the care they need to deliver for themselves. We can do a better job of helping people understand what's required and put systems around them in a way that they'll be successful. 80% of serious medical errors happen when a patient's being transitioned from one care setting to another. We owe it to the patients in our care to focus on this and to understand that this is vitally important. So I ask you to take a journey with me, and I ask you to think about my mom's experience and our experience, and could those kinds of wonderful things and those kinds of less than wonderful things be happening in your own organization? You've seen this slide before, and I considered pulling it out of my deck, but I wanted to be sure to make the point that as you sit in this lovely ballroom today, you may tell yourself, those things aren't happening in my organization. We've got quality reports that say that we're doing very well. We've got a readmission rate that's lower than the national norm. I'm confident we're doing well. What I want to ask you is, how do you know? Is it just because somebody's told you so? Or do you have boots on the ground and eyes in the field, watching each individual care transition and ensuring that the way that that care is transitioned is consistently at the level that you would want it to be? Because if we don't have folks looking, if we don't have eyes in the field, boots on the ground, we don't know. And so 2 things I'd ask for you today. First is to leave here understanding it's more complicated than you might have thought. The second thing I would ask you to leave here understanding is that it's more important than you might have thought, because it's not just about clinical effectiveness, the language, it's not just about the numeric results that we get. The work that your team is doing right now while we sit here is helping ensure that great-grandmothers get to spend a day with that first great-granddaughter that she might not have had without the excellent care she received. And for patients, regardless of gender or generation, the teams that you have in place, the teams that you lead, are helping your patients get to live another day, to enjoy the sunshine, to get to feel the wind in their hair, and to get to experience life the way each of us would want our own family members to do. Thank you for the work that you do, for the leadership that you bring, and thank you for paying attention to this very important topic. Thank you.